Hello, everyone. My name is Swanee Douglas, and I'm an undergraduate student at the University of Toronto. To give a bit of introduction, similar to the blood-brain barrier, the blood-spinal cord barrier can block a large majority of small and large molecules, and this can greatly hinder therapies for spinal cord tumors, injury, and diseases. However, microbubble-mediated MRI-guided focused ultrasound has shown preclinical success in both small and large animal models for blood-spinal cord barrier opening. Below is an example of the Evans blue dye extravasation and MRI contrast enhancement indicating opening in the porcine spine. To address challenges specific to focusing ultrasound in the spinal canal, a dual transducer approach was previously created by our lab to reduce focal depth. Additionally, a novel short burst phase keying or SBPK pulse scheme was developed to mitigate standing waves in the spinal canal, and this creates a more uniform focal spot as demonstrated here. However, a recent in vivo parameter study found that 2 millisecond and 10 millisecond SBPK pulses showed no significant MRI enhancement difference for opening in the spine. Upon further investigation, 76% of cases from this work showed a sharp drop in second harmonic signals typically associated with bubble activity beyond 2 milliseconds. And so the objective of my work was to determine whether microbubbles are being destroyed by focused ultrasound exposures within the first 2 milliseconds, and whether SBPK pulse parameters can be adjusted to prolong stable cavitation of the bubbles. I first conducted acoustic investigations of microbubble response to original and modified SBPK pulses using the experimental setup on the left. This involved a gravity flow of DEFINITY microbubbles through a 0.5 millimeter tube sitting at the focus of a dual transducer setup driven at 514 kilohertz for various pressures in 30-second treatments. Acoustic emissions analysis was performed using MATLAB, where I would input raw signals and divide them into short time windows, and then burst pairs sent with opposite phases were summed together to achieve pulse inversion, which has been shown to amplify nonlinear emissions. And after applying the Fourier transform to obtain frequency spectra, the maximum sonication across the 30-second treatments was selected, and a ratio was taken of treatments with bubbles and no bubbles to act as a baseline. Finally, the harmonic of interest here, the second harmonic was indexed by pulling the max value from the respective peak across all the windows. The first acoustic observations made were looking at 12 millisecond pulses for SBPK with varied burst repetition periods. And so compared to the 60 microsecond burst repetition in pink, longer or shorter periods of 30 and 120 microseconds showed minimal activity across the pulses. But looking specifically at the 60 microsecond BRP, there appears to be a sharp drop in second harmonic signals observed around 2 milliseconds, especially at higher pressures. In addition to BRP, it was investigated whether the constantly changing phase shifts inherent to SBPK pulses may be affecting bubble survival. And so compared to phase shifted pulses, short bursts alone, all sent at 0 degrees, present very low signal. However, this could be due to the lack of pulse inversion for this particular analysis, and the possibility that the less uniform focus with the short bursts is missing the tube phantom. And finally, another avenue explored was whether stable cavitation could be prolonged through pulse shaping. And this was achieved by applying Hanning windows to the transmitted pulses. However, the shaped pulses do show signal drop off after 2 milliseconds as well, and overall present lower signals. And this is despite having the peak negative pressure of the shaped pulses adjusted based on needle hydrophone measurements in water compared to the original pulses. In parallel to the acoustic tests, I began an optical investigation of microbubble response to SBPK pulses using fast frame optical imaging, and preliminary tests revealed the feasibility of using agarose phantoms with a small 50 micrometer channel to closely observe microbubble responses. And an example is shown on the right. Most notably, this work confirmed a short drop-off in second harmonic acoustic emissions from microbubbles exposed to SBPK pulses, and this drop was most evident at higher pressures, which could be explained if the tube phantoms on the benchtop were not aligned completely with the focus, and whether or not the microbubbles I used were reactivated or not. Additionally, this work revealed that parameters including burst repetition period, phase keying, and pulse shaping do not appear to prolong stable cavitation of microbubbles. However, the experimental setups developed and optimized through this preliminary work will certainly allow for streamlined future tests, which will aim to integrate both acoustic and optical observations of microbubble responses. And with that, I'd like to acknowledge the guidance of several members of the Focus Ultrasound Lab at Sunnybrook and my supervisor, as well as the Charles Steger Global Internship funding from the Focus Ultrasound Foundation. Thank you for listening.